Hello and good afternoon, and warm welcome to another episode of Knowledge Cafe, a program where we bring you knowledge, wisdom, health, and purpose from our inspiring mentors and seniors. Today, we have the honor of having Dr. Vinoy Singh, who's a not only a doctor, a professor of surgery, but a yoga expert and a wellness expert. I've known him for a few years, and he is I would say it would be difficult to explain and make his profile into one sentence, but expert in medical science, an expert in health AI, an expert in yoga. And I think the most recent that I was discussed, I came to know about him is his research and work on innate healing of the body and breath and body connection. Welcome, Dr. Vinoy. We are really grateful for you to have the time. हमें बहुत खुशी है कि आज हमारे एपिसोड में आप हमारे साथ जुड़े हैं. वेलकम टू आवर एपिसोड. वेलकम टू नॉलेज
Yeah,
कैफे.
thank you, ma'am. Thank you. Honor is mine.
You are a professor in surgery in from Patna Medical College. You worked there. Is there any defining moment in your career, where which kind of defined your understanding the way body heals? Was it when you were practicing medicine, or was it now, or when you have been working in yoga? When was that moment when you understood how the body heals?
Ma'am, I remember it vividly. It was 1987. I was a senior resident, surgery. 87, hardly there were any antibiotics. So from the jungle areas of the Himalayan foothills, a Adivasi was badly mauled by a bear. तो भालू ने उसको पूरा अपने हिसाब से, मतलब कई जगह से पूरा चीर फाड़ कर दिया था. ही वॉज जस्ट अलाइव हुआ है. हमने कुछ फ्लूइड्स वगैरह दिए और उसकी स्टिचिंग वगैरह की. सरकारी उसके पास कोई 1 रुपया भी नहीं. वो सरकारी एंटीबायोटिक्स वगैरह जो भी थे, थोड़े बहुत, बहुत ही लेस पावरफुल, वही उसको दिए. लेकिन जो मैंने उसकी हीलिंग देखी डे बाय डे, मिराकुलस, मतलब वर्ड अंडरस्टेटमेंट होगा. तो हीलिंग का बगल में ही और पेशेंट्स हैं जिनको 10 तरह की बीमारियां हैं, मान लीजिए डायबिटीज है या कुछ है, और उसकी हीलिंग तो एकदम, मतलब मुझे वो एकदम विविडली याद है कि कितना कुछ जो है सो बॉडी पर डिपेंड करता है. इनेट मतलब जो इनहेरेंट कैपेसिटी है बॉडी की. वेरी वेरियस फैक्टर्स आर देयर. वी विल ऑफ कोर्स डिस्कस इट एज वी गो अलोंग.
Sure. So that is the moment that you understood. I mean, that was a kind of a defining moment. Now, looking back, in like working in a rural medical officer in 19 late, 80s, and then to now in 2025, when AI is taking over every field and health tech is also, emerging. Is what do you see as a change in the way medicine is practiced over this period of 40, 4 decades plus?
मैम, चेंज में सबसे पहले मैं ये कहना चाहूंगा कि जस्ट एज ए मैटर ऑफ फैक्ट कि मेरी सिंसियरिटी और ऑनेस्टी में 1 पैसा का भी फर्क नहीं आया. ये जीवन ईश्वर की सबसे बड़ी मैं कृपा कहूंगा कि उस और इतना पुअर और इतने बैकवर्ड एरिया में मेरी फर्स्ट पोस्टिंग थी, जो लास्ट बस स्टॉप से भी अबाउट 7 किलोमीटर्स का फुट पर जाना होता था, या बुलोक कार्ट पर. उस एरिया में भी मैंने काम किया और पूरी मेहनत से काम किया. तो एक चीज जो उस समय मैं समझा कि कितने कम खर्च में हम वेलनेस का इन्वेस्टमेंट और इलनेस केयर का इन्वेस्टमेंट विसे भी, तो जो 80-20 के हम बहुत एस्पेक्ट्स में रूल अप्लाई करते हैं, वो उस समय मुझे बहुत दिखा. और आई यूज टू लाइक फाइट विद द डिस्ट्रिक्ट मजिस्ट्रेट और विद द सिविल सर्जन फंड्स के लिए कि आप अगर अब 80% फंड्स आती थी इलनेस केयर के लिए, 20% वेलनेस केयर के लिए. जबकि मैं डाटा से बताता था कि 80% वेलनेस केयर का स्कोप है, 20% इलनेस केयर है. लेकिन खैर, वो एक एस्पेक्ट जो है इलनेस वर्सेस वेलनेस केयर का, और उसकी बजटरी एलोकेशन और उसकी इम्पोर्टेंस, वो परसिस्टेंट है. आज तक मैं वो डील कर रहा हूँ. तो ये एक कंटिन्यूटी है. और केयर में मैं मुझे जो डिफरेंस की अगर बात करते हैं तो अवेयरनेस बहुत बड़ी चीज हो गई है, जो मैं देख रहा हूँ कि वो सालों साल वो इम्प्रूव करते गए।
And awareness can be the first step towards, being aware and then taking steps, right?
बहुत अच्छी बात कही आपने मैम, बहुत अच्छी बात कही। मैं बता रहा हूँ, मैं आईटी फील्ड में भी मुझसे, मैं आईटी और हेल्थ केयर को हमेशा ये करते रहूंगा, क्योंकि आई स्टैडल दिस टू, और बहुत अधिक कन्वर्जेंस भी है। और खास के अब तो बहुत हो रहा है आईआई से, कि लोग बोलते थे कि क्या है, हम लोग कूली का काम कर रहे हैं और वेस्टर्न वर्ल्ड का ये हुए। मैं कहता था कि यार शुरू होने दो धीरे धीरे। अवेयरनेस हेल्थ में भी मैं वही देख रहा हूँ। पहले लोग ऐसे को पूछते थे या थोड़ा बहुत करते थे, आज के दिन हर व्यक्ति थोड़े बहुत वेलनेस के बारे में जानना चाहता है। ये पैराडाइम शिफ्ट आई वुड से, लाइक व्हेन
Oh,
फ्रॉम द लास्ट 30-40 years।
so that's a happy thing, good thing that has happened.
वेरी गुड थिंग, वेरी गुड थिंग।
But from the overall system and governance perspective, you feel that wellness should be having more focus than illness, which has not happened as yet.
नॉट एट ऑल मैन, वेरी, दैट इज द वेरी डिसअपॉइंटिंग एस्पेक्ट। एंड
Oh, I think उसमें, if I as a layperson understand, I think this is also to do with the way medicine is taught, isn't it? The focus is on curing, right? जो मैंने समझा है, तो इसलिए जो डॉक्टर्स की जो ट्रेनिंग है वो क्योरिंग पार्ट पे है. And so naturally the whole medical system, then the pharma, then all the education, everything is around that. बट आई एम श्योर जो आपने बोला कि लोगों में अवेयरनेस आ रही है, तो हो सकता है दैट विल बी द जेंटल पुश नज, टू.
मैंने मैंने लाइफ में बहुत कुछ देखा। और देयर इज अ चाइनीज proverb that may you live in interesting times, that is sort of a, they give as a blessing. So many generations come and go, and hardly any change in their whole lifetime. But we are really fortunate, ma'am, aren't we, that in our lifetime, what all we are seeing, eh? So with the early battles we saw and the current battle going on, same in healthcare, and these paradigm shifts which are happening. But of course, like, I would have been happier if the pace would be a bit faster. But you are very, very right, ma'am. And being a surgeon and then an IT, I always bring things to very, like, very objectivity. I am saying this that because the fundamental aspect itself is wrong. Because in our old societal days, the two activities were non-commercial: healthcare and education. Because there is a conflict of interest. If you say, because if a cured patient is a customer lost.
That's true. Unfortunately, I think that's the way that's the interesting times that we live. So most people एक सर्जन को ना तो वो योगा टीचर की तरह देखते हैं, ना एक एआई एक्सपर्ट की तरह देखते हैं, राइट? So it's a very, I would say, maybe a deadly combination: surgeon, yoga expert, and an AI expert. How do you juggle between all of these roles?
जगल नहीं है मैम, यू सी, सर्जरी, अगर मैं शायद सर्जरी छोड़ के कुछ और रहता तो ये जर्नी नहीं हो पाती। सर्जरी क्या है? स्टेप बाय स्टेप ऑब्जेक्टिव लॉजिकल स्टेप्स होते हैं। तो सॉफ्टवेयर क्या है? लॉजिकल स्टेप बाय स्टेप सॉल्यूशन, सॉल्यूशनिंग। सो बोलते भी हैं लोग सर्जिकल प्रिसीजन। तो सर्जरी एंड इंफॉर्मेशन टेक्नोलॉजी के जो बेसिक, और आपको आश्चर्य होगा कि मैंने अभी तक बहुत डॉक्टर शिफ्ट किए इसमें, 99% है सर्जन। तो ये एक डाटा है। मैं शुरू में इसको जस्ट कॉन्शियस समझता था, लेकिन बाद में मैं इस पर ध्यान देने लगा। तो और सेम विथ योग, आप उठा के देख लीजिए पूरे भारत में जो डॉक्टर्स योग में शिफ्ट किए हैं अभी तक मुझे, वो सारे के सारे सर्जन्स मिले हैं। वो छोटे शहरों में, एज एज स्मॉल एज भटकल, एज बिग एज रायपुर। मतलब मैं अभी मध्य प्रदेश गया था, ऑर्थोपेडिक सर्जन है कोई है। तो ये सर्जिकल अप्रोच जो एक होता है, where you are a team member and you are result oriented and no non ambiguous, and बात बनाने से वहां काम नहीं चलेगा। वहाँ सामने खुला हुआ है पेट, तो आपको कुछ तो करना होगा, नहीं तो फिर बंद कैसे होगा। तो ये सर्जरी, आईटी और योग हीलिंग से आया मैं। तो सर्जरी और आईटी वाला पहले जर्नी हुई, बाद में योग का तो काफी लेट, 2010-11 में। उसके पहले आई वॉज हार्डली एन योगी, आई टू स्मोक एंड नॉट ड्रिंक, बट आई यूज टू ऑफ एंड ऑन स्मोक एंड बी लाइक ए नेचुरल। कोई भी एक फिजिशियन मेडिकल बंदा होता है, और आईटी में भी मैं सीनियर वाइस प्रेसिडेंट वगैरह था उस समय, तो इंटरनेशनल ट्रैवल है, पार्टीज है। माई लाइफ स्टाइल वॉज वेरी मच लाइक एनी हाई CXO। तो योग बाद में आया, और उसकी कन्वर्जेंस और सिनर्जी वो मैं मतलब अलग तरह से समझा पाता हूँ, बट इट इज नाउ रेट्रोस्पेक्टिव। वो नेचुरल फ्लो में नहीं आया, जर्नी के रूप में नहीं रहा वो, ये मैं कहना चाहूँ।
So has yoga helped you in understanding the medical part as well, or the medical part helped you in understanding yoga better?
Fantastic, thank you ma'am for this question, really great. And the answer is, I'm very clear. Initially my medical knowledge helped me understand yoga, but now the yoga is helping me understand it better.
Okay.
I will
Okay.
give an example. Like initially, like certain aspects related to surgery, I would say, and like a general surgeon would get most more cases of the gut and all related and all that. So I could see the help how yoga or yoga maneuvers would do. But now, when I am coming from the yoga side, I am understanding how the microbiome, the gut biome, or the breath, or the visualization, etc., can help. And the same you can see also. If if you look at the surgery, surgical procedures vis-a-vis yoga, then you see the early research is more towards approach from the surgical side, but now the research is happening from the reverse side. In many countries, a lot of work is happening now, the surgical procedures and yoga.
Okay. Okay. So, uh, I remember in one of our initial earlier conversations, you have said that that modern lifestyle tends to ignore the innate immunity or the healing power of the body. So, what would be your suggestion that how do we activate it? What are the ways that people like me and normal people, common people, can activate that innate healing of the body? What should we be doing?
Very, very simple. See, as you already we discussed and we agreed that people are becoming, at least they have started applying their mind towards wellness. So that's the first step. Simple. Now, the second part is that we have to understand that what are the tools we have.
Yes.
So tools, the two most important tools are what we eat and how we breathe.
Okay.
It's not I am saying, Raman Maharshi said this. People used to ask him. So in our living memory, recent times, he was the fully realized person walking around among human beings. So Raman Maharshi, so he told that only two things actually matter: what you eat and how you breathe. So and that is the key. So wellness tools are, a lot of tools are there. So we should not only consider that yoga itself we can think of. Yoga and wellness is synonym. We should consider as synonyms. So all these tools are wellness tools, are also yoga tools, and they are mentioned like that also. Yogic texts are mentioning about ahar, they are mentioning about pranayam. So it is really the same. The tools are the same, and we should be aware of those tools. And then the sub tools, like in ahar, we have to when to eat, how to eat, and what to eat. Three
Okay.
sub aspects.
Okay. Okay. We'll get into a little more details about those two, the खाना और breath work, सांस कैसे लेना है। हम सोचते हैं कि हमको सांस लेना आता है इसीलिए जिंदा है, बस सिर्फ जिंदा ही है शायद। सो आपने ये बताया कि जो एक एनर्जी को हमें रीडायरेक्ट करना है, इट्स ए लेयर ऑफ हीलिंग अपार्ट, नेक्स्ट टू द like the food and the breath work is the energy that we redirect in our body to the healing part. How do we, I mean, how do we, as a layperson, impact that energy redirection towards recovery and wellness overall?
Actually, it's very, very simple, ma'am. See, if you ask me what is my biggest frustration, is the same that what I think is so simple, but I am not able to explain to people or rather make them do that. So that is my biggest, I can say, like the unsolved puzzle for me.
Mhm.
See, the simple is that breath is the energy. I would say that it is the manifestation of that aspect, energy. And so we have to start with being aware of the breath, and that is the only starting point. We cannot start from anywhere else, because and more as you become aware of your breath and you trace your breath, the going air, the outcoming air, and trace it longer and deeper, and not being aware of anything else. So being that only as the pratyay. Pratyay means I like a uh, support, or like the entity in your mind, like at that
Anchor,
moment.
anchor, anchor.
Anchor, yeah. So pratyay is like you're holding something, but that is the only thing in your mind at that time. And then you can move it. Then you can actually take that, that is a part of the visualization, to the areas where it is required, where it is like required more, like an osteoarthritic knee, or a hypothyroid thyroid gland, or a gastric acidic stomach, whatever. So, but that's why it is all a matter of practice. You have to start practicing with the breath awareness, and then the energy visualization and movement. Very simple, actually, and we can use it in day-to-day life for our benefits.
And how many days of practice, or how long the practice would be required to reach somewhere closer to the results that I can, direct my breath and consciousness to the healing of a specific part. Or supposing, let's say, I'm feeling very stressful, or somewhat anxiety or anger or any negative emotion. So how long I would need to practice to get there?
See, we're looking at it as a component, because, like, I do have a course of breath as a life force. So I have to break it into a small component. So for one component of like simple awareness of the incoming breath and outgoing breath, comfortably being aware is around 42 days. See, any practice, it is also very objective. It is called a Saur Mandal. So 42 days, if you practice something, it goes to it like a muscle memory or something. It goes at a different level in your existence, in your body. So the first level, where you just trace the air coming in, going out, becoming aware of that, there is one sub aspect of it. The second sub aspect is that continuing with that awareness while you are walking, or while we are doing something very mundane, routine, that is called like mindful walking.
Okay.
So then we are extending that visualization, or you can say awareness, to some extent. Then we have to extend it to something where a part of your mind is required to do the work, like cooking. And can you be aware of it? So every is a 42-day cycle of practicing one sub aspect of it. This itself is sufficient. This breath awareness, I'm telling you.
I have two questions out of this. You said that you have a course on breath awareness and mindfulness. वो लोग कैसे attend कर सकते हैं? How can people attend that course?
No, see, first thing, I take it one to one, and only for very needy people, like CXO level or something, who are like in a real crisis, or people refer to me. Uh,
But that would be unfair to common people, Dr. Vinoy. आपकी
no,
motivation को
see,
मिलनी चाहिए.
nahi, this is Brahm Vidya, and it can be passed only through Gurukul method. That I have realized. It cannot be made into a circus. So I look forward to, unfortunately, financially, I have been never comfortable. So, so if there would be somebody supporting me, I would have a small place somewhere in Himalaya where people can come and spend some time. That is my dream, and I have never been able to save that much to have that place. So that is the way it goes. And I also attend only if I also go. I go and stay with people. Like I will be going to the Ars Vidya Gurukulam for about a week.
Uh,
So near Coimbatore. So there are very scientific places which are offering some advanced things. So I also go and learn. That is the only way, ma'am. Actually, see, you have to withdraw a bit, at least for the learning part.
Okay.
Hmm. And you have to like have just to your look at your mobile about an hour or so max in a day, during a day.
Oh, okay.
Huh. So that level of withdrawal is required at least.
Literally devoting oneself to it.
Yeah. At least for learning part. Then you can come and then you can actually.
Okay.
That is my experience, because I have tried everything and I have, but it doesn't work. People take it very superfluously and superficially,
Yeah,
and it
the
is meant.
imbibing doesn't happen. The imbibing and the
Yeah. So
absorbing it and imbibing
it
it.
is it is a, it is a, it is a Guru Shish Parampara technology. It cannot be
Okay.
transferred
और
into.
आपने बोला 42 days. Usually we have heard 21 days to form a habit. आप कह रहे हैं
नहीं 42 days, 21 नहीं है.
double of 20.
21 people, see, to get audience or whatever. लोग जो दूसरे को सुनने में अच्छा लगे वैसा लोग बोलते हैं. कुछ लोग बोलते हैं 1 हफ्ते का कर लो, है ना ये. तो आप, मैं तो बोलता हूँ कि आप 3-4 दिन में सीख लो और फिर घर में प्रैक्टिस करो.
ठीक है. Okay.
बट वन थिंग आई हैव सॉर्टेड आउट, मैम, दैट how to start, where to start.
Okay.
It cannot be anywhere. It has to start the previous evening. So you cannot start in the morning. You have to sort out your evening.
Okay. From the time you go to bed, not
Before 3-4 hours before that, you
yes,
start.
and not from the time you wake up, but you're
Yeah,
saying from the previous evening when you
yeah,
go
yeah,
to
yeah. So yeah, yeah. So
bed,
yes,
it starts from there.
yes. So
Up, and that's where I think some of the we have to make it easy for the younger generation and younger generation क्यों हमारी generation का भी बात करें तो सभी को थोड़ा सा easy format चाहिए होता है. Coming back to like your early surgical training, I think naloxone shock research to yoga-based care for NCDs. Like, what do you think is the connection and the difference both? You know.
no, that's a very interesting question. See, when I did that work, thank you for asking, because the naloxone was not available in India. I had to import it at US for doing that research, and it was a work done on dogs. So 40% of their blood was taken out. So it was like we were simulating bleeding, and then we were trying to manage the shock, the rate of loss of blood, and all that. My whole life I have been researching mostly trauma. Wherever I have been, I think emergency surgery has been my super specialty. So what I realized, that again I remember each and every dog, I'm telling you. Unfortunately, none of them died. So I was very clear, uh, and the apparatus and all that to revive them. Is the you can say the holding on to life. How the body systems, everything, and like we would bleed a 40% of the blood we will take out in say 7 6 7 minutes. Imagine blood volume, total body blood volume. Still, how all the systems change, because we were mapping it, we were seeing. So how life tries to like continue, and that I also see in the patients. And that will be very technical, but there is a system called triage, means prioritization, the French word. So our trauma is like mass casualty situations. I have some work done on that for the robotics part. How to objectively triage, because if a young lady having a t-shirt and a jeans with some blood here and shouting, all the doctors will rush to her for sure. But a person who is really requiring support would be just saving his life. He will not have the energy to shout. He will be just breathing like this
Oh.
at a corner. So we have to go to that person, not to this young lady who has the energy to shout at this moment of time.
Okay.
So that is the triage thing. So I learned that, and I used to always teach that in my. Unfortunately, had been like in charge of a very very busy emergency. So I am very thankful that I've been able to God to create many very good emergency surgeons, because this early thing I used to always convey to them, that see that corner, that patient we should rush to or take him up. or take him to the OT. He needs immediate intervention.
Okay. Okay. That's very insightful, I would say. I mean, being a non-doctor, we don't understand these things. हमें लगता है कि जो पेशेंट ज्यादा शाउट कर रहा है उसी पे अटेंशन जा रही है, and it's human also that that some where I mean and that person is also howling, shouting to draw attention, basically, right? Yes.
And it actually, I'm not giving this example just by lag, that I was at my residence having cup of coffee, and till today also the flights landing at Patna go above my house. So I saw a flight going. I told my wife this is going to crash, and couldn't take out my car. I took out my scooter and rushed to the hospital, 1.5 kilometers. By the time I reached, and I heard the crash in 10 minutes. The Alliance Air crash happened before the Patna airport, and many people survived. So I was there in my casualty, as in charge of my casualty, and when the patient started coming in, and actually there was a young lady, very aggressive, she was making a lot of noise, and I go, "Shut up!" So a lot of other patients. So I had a real life experience of doing that triage and teaching everybody. By that time, the whole department was there, the surgery, orthopedics, everybody. So we all learned that, but they knew that I'm a very good trauma surgeon, so they listened to me. I just pointed out, pick that one first, then this, because they were bringing them in ambulances, 10 per ambulance. So I have worked in that scene also.
That's very uncanny and surreal कि आपको आपने बोला कि ये प्लेन क्रैश होने
हाँ,
वाला
क्योंकि उसका trajectory, I was every day we were suing ना,
है. Okay.
So it was, trajectory was such that it would not reach the airport. It was almost like it, it
Almost
landing before that,
almost going down. Yeah,
somewhere. It and landed it. Fortunately, it was an open place, and the pilot managed to do a lot of maneuvers. So almost it was like a belly landing. So many patients survived. Many people survived. Hardly, I think only 10, 12 people died in that.
yeah. Okay. So we have spoken a lot about your clinical experience as well as about the yoga, but we have not discussed about health informatics and health AI. So how do you see that, the technology enablement? Like yoga has made us aware of lot of things, made us aware about breath, like pranayam बहुत common हो गया thanks to, I mean, I think I would give credit to the Patanjali, yoga ashram and Swami Ramdev for making it household name. हर पार्क में लोग प्राणायाम करते हैं, वो ठीक करने गलत करे वो हम नहीं जाएंगे. तो हेल्थ इंफॉर्मेटिक्स और हेल्थ एआई का ऐसा रोल कॉमन मैन के लेवल पे, कॉमन पर्सन के लेवल पे इन इन हेल्थ केयर सिस्टम्स, इन हेल्थ केयर डिलीवरी, वो आप कैसे देखते हैं? डू यू सी दैट हैपनिंग? हैज दैट हैपेंड टू सम लिमिटेड एक्सटेंट?
Ma'am, the potential is enormous, but worldwide, the usage is very, very minimal. I'm saying this taking with full sense of responsibility, only because there is lack of sincerity of action, and even if you go before that, the honesty of purpose is not there.
Okay.
Otherwise, the benefits which have being delivered to the mankind, or to the living, all the living people, would have been enormous. That is one of the biggest. So I still am hopeful, and still I am struggling. Like this is my, I have written in my LinkedIn profile that the third wave of informatics. So the third wave means, when I mean that the AI, I am again having hope that this AI may be able to overcome the bottlenecks, or the hindrances which are required to implement this informatics actually.
And that brings me to the question of, I'm aware of your involvement in few of the very advanced level health AI based projects on mental health, right? You I think, and those are supported by IIT Kanpur or Stanford, or I mean, at least those institutions are involved in some way or the other. You can tell us a little bit about those?
See, that is one aspect
Those
that where,
that can be explained in, to the common people and public knowledge.
yeah, artificial intelligence is nothing but actually a very optimal use of information. The human mind can think, or you can say manage four, max six dimensions, but computers can manage hundreds and thousands of dimensions or axes. Like we have an XY axis, ABC axis. So three, four, I'll give you example like a salesperson and an area. So that is very simple. Okay, this salesperson, this area, this is number one, this is two. But if we put all the data, all the sales data, then certain hidden aspects come up, which are more than those three, four axes along which the data was analyzed. So this is the artificial intelligence is that only. And but when you take it to further and more complex, well, like neural networks, so our nerves, our neurons work like many inputs, and there is only one output. So the sum total of all input decide, but the output is one only. So this is the neural network. So the models are trained on that, and we call it like loading. So the inputs or the parameters are the loads on the neurons, and we have layers. So this is the basics of AI. So my work is related to the non-verbal markers of voice, like tone, pitch, energy, pause, shear. So a lot of research work has happened on that. We are also at the cutting edge of this research. So sadness and depression are two different things. Tiredness and depression are two different things. So our model is
That,
fortunately
sorry,
able to.
what is different? Stagnation.
No, sadness. Like you may
Sadness.
be sad, but you may not be depressed, or you may
Okay.
be depressed, but you may be appearing very happy.
Okay.
So our model is now trained to the accuracy level of more than 86%, where we can differentiate, or we can, let me put it this way, that we can judge or diagnose a person who is depressed to the 86% plus accuracy. And a successful pilot has happened in engineering college. We were able to find 14 severely depressed or moderately depressed students, which were confirmed by psychiatric evaluation later on. 12 boys, 2 girls. Many were having suicidal thoughts. So that is and you can imagine 300, 400 students, no institution can afford to have an individual counseling or an evaluation. But here, this one tool and just 2 minutes of voice sampling and analysis and an AI model. So the management was both relieved and worried that we have such seriously depressed people, students who could have committed suicide, and relieved also that we were able to find. Now the tricky part is that are we missing one or two, or are we overdiagnosing? So that is the fine tuning we are working on, which is called the prevention of false negative, false positive, and all that, as you are very much aware. We're trying to not have any false negative, and false positive may we if we are to err, we should err on the false positive side as in the false
Yes,
negative side.
that's
We
to be
don't
more
so
conservative.
don't miss a single student. And actually, see, if like there were like about 1200 students and we are like 14 students, we have had hardly one student per 100, 1%. And so if we miss one out of 100, and we can say we are 99% accurate, but we are actually 0% effective.
Yeah.
So
So,
these are the,
at Inspiring Seniors Foundation, our focus is the senior citizens. And there are a lot of mental health issues with senior citizens, that there is loneliness, there is isolation, lack of purpose, some of these. We do try to address these, I mean, in our own humble way, we are trying to address these, through our programs and through, Wellness Chopal also, which you're also part of, and you've been, giving talks on that. What would be, do you think that such, AI-based engines could be helpful to the senior citizens also? Like with,
very much, ma'am, very much, ma'am.
looking after their health in a very frugal and very economic manner, because senior citizens can't even afford very expensive counseling sessions. Yes.
I agree with you, ma'am. See, this is one more of my dream, and we are at a very critical stage in working on this. So what we are trying to do is that we are trying to incorporate some virtual reality games, actually, not games but situations. So extended reality, not virtual reality, that is called extended reality. So for elderly, we are both for diagnostic and therapeutic for early dementia and all. And we are having like a game we have to play, like you go and buy some vegetables and come back. So that will be both diagnostic and we are a very early stage, but we are working on that. So our next target is dementia only. We come out with an AI model and some tools where we can both be screening, because there is nothing there except early pickup. So if we pick up early, we can do a lot. So that's where we are actually working. Even for depression, see, depression, as you are aware, working, both of us are aware, working in this field, is a function of loneliness for elderly, I would say. So what is there to diagnose? If they are with some people, like we always say, engaged, if they are like having some, like, so many good singing sessions we are having, and we are having such some beautiful sessions, that's sufficient. So actually, not much to diagnose we can do, just to manage, to alleviate their loneliness. But yes, screening can be done, ma'am, and this is very useful. And we can pick up some severely depressed people, so we can prevent some negative acts,
Serious interventions.
incidents. That it can be used very much as a screen. And it's very simple and no cost, nothing. It is very simple. Just you have to speak for 40 seconds and the result comes. That's all.
And I would catch on to the to one particular suggestion by you, that what is there to suggest. We already know the solution. So in your view, if the seniors were to be engaged in some activities, what would be those activities that they can to stay away from depression and anxiety?
Friends. So see, there's so much work worldwide that the friends are the best cures for depression. So uh,
How about जैसे आप social volunteering करते हैं, उनके लिए volunteering propose करेंगे आप, that they
बहुत,
should engage in activities?
ma'am, that is the ultimate. See, many people have helped. I will just give you one example. There was a guy who was, rather, I will give you two examples. One example I remember, I had been to a project in Zimbabwe, and there I had asked people that I would like to meet some local Indian leaders and all. So I got to know about a guy. I went to meet him. He had a 16-bedroom villa, and you can't imagine, he was so rich. And he was staying alone in that house. He cried. He was crying. He said that one son in US, one son in South Africa, and this is why the whole team, you come and stay with me. Why you are staying in a guest house like that? So I said, no, thank you. But I told him to start doing some activity. So I said that why you are sitting at home only? So go and spend few hours in the local temple. Go there, and when people come, you just chat to them, talk to them. I'm telling you, the most engaging, most fruitful engagement for elderly is if they just talk to the youngsters, because the youngsters are so tense nowadays that like in Japan they can hire elderly people. So here also we can match some people. So I engage him in that, and later on, to cut the long story short, now he's the secretary of the Indian Society there, and I talk to him once in a while. He has maintains a register. He goes there at 8 o'clock, 9 o'clock. He stays the whole day. He has functions every Sunday, lunch, community lunch, this, that, blah, 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 cricket match and all. So once you come out and engage, another example of that in Patna is very depressed, single, alone, wife, dad, no children, both outside. I say, you are having so much money. I just take 3, 4 thermos of hot water and come to my hospital. See how many poor people are alone and nobody there to take care. And a bottle of Horlicks. Give them, make Horlicks for them, give them half glass of Horlicks. 8, 10 patients, you come talk to them. Later on, you imagine that guy, the full-time vacation, he used to come with postcards, used to write letters for them, he used to give them hot water. So he used to now come up. So once you are out, there's so many, rather I had made a list of 50 activities what you can do when you come out. When so something like that is really very, very good, very good.
So being engaging with friends and going out of the home and engaging with others in whatever capacity, giving back to the society are some of the common things that they should be trying to the extent people can.
Extremely important, extremely important. That must They must follow a routine. They make their beds in the morning, take bath, get ready, come out of the house.
Mm. Correct. I'm sure that there is a role that government and systems also have to play in, in making it happen at a societal level. Like we do have societies जहाँ पे मंदिर है या कुछ ना कुछ engagement है पास के कोई स्कूल में, but एक उसको formal तरीके से help करना. For example, a lot of talk these days about, elderly friendly cities. For example, payments नहीं है, go out of the house, but there is no payment to walk, right? So, or there is no park nearby, so some of these limitations are there, but then I think people living in gated communities can definitely go out and, or having access to park or, some, good roads, payments. Uh, you have yourself done so much of volunteering, right? Social volunteering, as you call it. Professionally and personally, which project or which something that comes to your mind as being most fulfilling?
That's a very interesting phase of my life, and I got almost killed in that, but it was a headline also. The Sun Times, I don't remember the date. See, you might have heard about this Ekal Vidyalaya, one teacher school.
Mm-hmm.
So I got involved in that. So I chose up the Naxalite area to initiate these one teacher schools in those areas. So that time, the Jahanabad district of Gaya district of Bihar were very much. I was in Patna Medical College assistant professor. So I initiated and some funds started coming. So I used to go to these areas on my scooter and to identify teacher and education. And later on, what happened that the Naxalites also started sending their children to these schools. So there was a division between them and the fight, a sort of a fight between them that we should send or we should not send. One group threw a bomb on me, so my leg got hurt. But it was a containment bomb, so it didn't explode fully, and also I survived. But then the matter came to a crunch, and then they decided in with full clarity and their senior committee members that no, our children will study.
Okay.
They should not be deprived of education. So that victory, that incident, and that victory for education, I remember very well. And so, in my whole social service life, that is the most relevant, important, and you can say that helped me actually in some certain southern other activities also in left, because Bihar many districts are very much affected by extreme left militancy, and I was very comfortable. I used to go there and meet with them and talk to them and explain to them. So that is a very interesting experience I have with this. It came in the Hindustan Times, big news used at that time. I remember paper cuttings and all the Naxalites also sending children to school, something like that.
I remember that in your profile, I saw that you have been a WHO's digital health expert roster also. What it means to be on that, what it involves, and what work do you do as part of that?
Yeah, see, basically, they have the developing world, they have mentorship and guidance, both offline and online. So you have to offer yourself. Of course, it is a selection process because it's a very prestigious role. So people offer themselves for this. There is not much remuneration, it is mostly cost basis. And we do help the developing world projects. In that context only, I worked in Kenya and Tanzania and Zimbabwe. Zimbabwe at that time also was a failed state, but there was a telemedicare project. So I spent about 28 days there and working. So these are you provide a functional guidance to healthcare projects. You are in a part of a panel, and uh, that it is both challenging and prestigious because of my background, last previous background, creating value. Basically, they look at very cost effective value creation because funds are very scarce in these countries, and even WHO or UNICEF also not much funding is there. So these panel people are actually like Nepal also. I was selected, mother cleared, but somehow that project didn't take off. So, but I would be have been there also, like in these are usually 2 month, 3 month projects like that, where you go and help them, guide them.
Okay. 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 So, as you have also worked in NHS, and so I mean, NHS is world famous, right? I mean, for its systems and processes. You have also worked a little bit on Ayushman Bharat, the PMJ, the on the. So, how do you think the data management policies of the are we, because we are late starter, but then being the late starter, we may have advantage of having the latest technology versus an NHS which is an old scheme, of course, a comprehensive scheme. So, is there any lessons or any comparisons that we can draw?
So my total experience, most of my experience is in Scotland actually. So I was based in Glasgow, and I've done all the projects for like cancer, breast and gynae cancer, head and neck cancer, cleft lip and palate, and a lot of other systems in Scotland. So they were Scotland-wide systems because more or less there are 4 countries. So it is just United Kingdom, but many things like they have an own parliament and all that. So later on, after I became very famous or like some success I got, then some of the hospitals in London, they called me for some projects, Hammersmith and all, where some projects I did. So
Sometimes that's a good lesson, what not to do.
what not to do. So that's
Yes.
why here, but nobody, I don't know how many people read that project report, but I would happy to know that at least they are teaching in the health informatics courses in India
Yes,
what
I
not to
think,
do, what
yes,
not to do.
what not to do, what to do, and वो बोलते हैं कि what to learn and what to unlearn also.
Unlearn.
Unlearn. That's a new term that has been used for few years now. Now, I think in the last section of our episode, I would like to ask you, see, being an academic, being a clinician, academic professor, or a corporate executive with, or a public health expert or yoga expert, which environment you found most fulfilling, and which environment gave you more room to innovate and to be yourself, to do what you wanted to do?
See, ma'am, most fulfilling and most, you can say, what to do, innovation also is my surgical. In 15 years, there were very, very challenging situations, and you have to innovate while you are operating, like firearm injuries or multiple stab injuries or accident cases and all that. And fulfilling that, if you, by your knowledge and skill, you save a life. Um, Then yoga is a different way where I like I could you can say bring more calmness to myself. I would say like it is more fulfilling in a very personal way. I should not be sometimes looks appears selfish to me because I'm not able to disseminate this knowledge to as many people I would have loved to do. And I really there are I try, I what not I have tried. Like I never take money from anybody. I go to institutions. I don't even take reimbursements, even not even the stay charges, so that there is no
Maybe if you start taking it, you'll be able to open a group.
no, no, that also I see. Can let us see. But I'm a very hopeful guy. So IT to some extent because it was breaking the barriers of time and space like this. It was becoming like a force multiplier. There was a sense of satisfaction that these things are like certain small things which we were able to do in Scotland and all that. So it was like good for health delivery. When I came back to India and the companies I worked with, here what happened that my interest was in the clinical decision making areas, the cognitive areas, but the requirement here was more on the enterprise side. So the human resource and the registration, billing, insurance, and all those things. So I made those modules, and pretty good modules, and they're very, and those are the modules which are working and still live. So the areas which I would have like loved to work, only one or two hospitals, like out of 200 hospitals where my software created softwares are working, hardly say 5-10% is at the cognitive level, at the decision making level, where I would be like the love to contribute. But fine, life, you have to take what life gives you. So everybody interested in making money. So pathology module, fantastic. Radiology module, fantastic, because those are the pharmacy module. My God! So every hospital is very interested. These three are the money earning modules, and insurance module. So those modules I created, they are fantastic actually. Like I brought
So
a lot of
what is it
innovation.
that you're currently experimenting or learning or doing? वो अभी अभी आप क्या कर रहे हैं? अब कौन से प्रोजेक्ट पे और कौन सा, लेट्स से एम्बिशन तो नहीं कहना चाहिए, क्या फुलफिलिंग प्रोजेक्ट है जो आपके दिमाग में है?
नहीं, एआई का ही है, मतलब दैट इज माय, यू कैन से अगेन, आई एम होपफुल that AI could break that barrier of dishonesty and you can say vested interests in Medicare. So let us see. On that, I'm working at some with some groups, early startups, 3, 4, and very interesting approach. One is the like in the diagnosis itself. My focus is always where I can help in the diagnosis
Okay.
using AI and the SNOMED CT.
Mm-hmm.
So let us see what we can achieve.
So that's your next project जो आपको fulfilling लगता है?
Definitely, like my vision is that like any language in India, any person, lay person starts talking, and parallelly the system can walk with that person, assist the doctor, help the person, and to help in a correct diagnosis and a cost-effective treatment. That should be the ultimate, you can say, use of technology.
Sure. We would all pray and wish for its success because we will all benefit by that. So if now you have we go back to the origin, initial discussion we had about starting with breath as a changing pattern that we need
Mm,
to
mm,
adopt in our
mm,
lives
mm,
for innate healing to kick in.
mm.
Like you to give our members, our viewers, a very quick tutorial, 2 to 3 minute tutorial on what they should be doing starting on the breath work. जस्ट एक ले पर्सन को समझाने के लिए आपने पहले हमारे वेलनेस चौपाल में भी कवर करा है, बट अ वेरी क्विक कैप्सूल, इट मे नॉट बी टू योर सेटिस्फेक्शन
नहीं
बट
नहीं
मे
नहीं नहीं नहीं,
मे
very much
बी
satisfying. No, no, I have 1 minute, 2 minute, 3 minute,
दो
all side of it.
आप
So,
2-3 मिनट में बताइए
हाँ एकदम, नहीं नहीं, सिंपल
हम
है 2 मिनट.
सब हम सबको कैसे बेटर हेल्थ मिल सकती है डूइंग दिस वेरी सिंपल टेक्निक बट वेरी इफेक्टिव विच इज
सिंपल है मैम. पहला पॉइंट तो हमेशा रहेगा कि अर्ली एंड लाइट डिनर. तो जितना अर्ली आप कर सकते हैं, अगर बिफोर सनराइज आप खत्म कर सकते हो, ठीक है. इसमें मैं क्लियर करना चाहूंगा कि ईटिंग इज वी हैव टू अवॉइड, नॉट ड्रिंकिंग. सो च्यूइंग इज टू बी अवॉइडेड. सो यू कैन हैव थिन सूप and we can have buttermilk, we can have fruit juice, something like that. But feeling very very hungry at 7:38, 8:39, will take some days, but in 42 days you will become very comfortable, and so you won't be having late dinners and heavy dinners. That is non-negotiable, and that is should be the starting point. Second is avoiding screens about 1 hour before you go to when you hit the bed. You're hitting the bed at 11, you have to move away from screens at least 1 hour before. That is also almost none. And this is achievable. These are not like non-achievable things. And if you just plan your routine, you can do that. This is the second important point. And third is that a bath in a bit of a, with a bit of an awareness in before going to sleep in about 2 hours, 2 hours, 2 hours before going to sleep. That is number three. Number four is that a bit of some chanting just before you close your eyes. So it can be Brahmari, it can be Nadanusandhan. And last should be the
What
fifth.
kind of chanting, like Om chanting or like?
Yeah, Nadanusandhan is that only, Om. And Brahmari is the in, so
Okay.
any that vibrational pranayam it is called. There are
Okay.
two aspects, Nakar and Makar.
Okay.
And last is the surrender. Just before you are falling asleep, you surrender everything. To keep apart your belongings, your relations. First your belongings, then your relations, and then your body, and just surrender yourself to sleep. So this is very important. If you do these five things, then you wake up light and early. So light and early dinner is for light and early waking up.
Waking up. Okay. Okay.
And when you wake up, then you have a glass or two of tepid water. You can have with some honey, some giloy, some haldi, some neem. Well, there are a lot of the people are taking small, small things. So something you can take, like not much here. But before brushing, before even rinsing your mouth, the first, because it is very healthy that whatever is there in your mouth, you should go back into the
Oh,
stomach. So,
okay.
without rinsing. So you, and then you stretch yourself upwards, sidewards, twist and all that till you feel the urge to for motion. Clear your bowels, then do some pranayam. That's it. So nothing more is required actually. Then you are fit for 21 hours. I'm telling you, if you do this much, next 21 hours you will be energetic, you will be productive, you will be working.
On the breath awareness, just a little 1 or 2 minutes on that part also, sir.
Breath awareness means that the breath, the air is going in. So when it's coming out, so tracing it, the number part one of that, part of one of the awareness. Then important, very important is that extending the exhalation. So that is critical because normally when we are breathing like this, it is the inhalation is active, exhalation is passive, which is shorter than inhalation. Every breath, some stale air is remaining back. If you
Okay.
just extend the exhalation,
Okay.
make it conscious, then the lung is fully emptied. There is
Okay.
no stale air with high carbon dioxide content. So this scatters the laziness, the tamas. So such a simple way you can reduce your laziness. As soon as you start extending your exertion, you can feel that okay, that laziness will go or that drowsiness will go. Then the third aspect is the visualization that I am taking in health. I am throwing out garbage, and then a bit of a smile on your face, accepting things and all that. These are the four aspects of breath awareness. Then, as I told you in the beginning, we can extend it while we are walking, then while cooking. So, with more and more activities where a part of your brain is required. Initially, you are sitting and focusing totally on breath awareness. After 42 days, start mindful walking. After 42 days of mindful walking, you can start mindful cooking. Like that, you can extend. You
Okay.
can see the benefits, how this breath awareness will start helping you in calming down the mind and all that. Then you, before every meal, you can be aware of a few breaths of yours. That's sufficient, I think, that to start with.
I remember you are one doctor who says that बहुत exercise की जरूरत नहीं है. Whereas most of the doctors are recommending cardio and intensity and all that. You have been focusing on simple eating, simple sleeping, early sleeping, those 5, 6 habits that you said, plus the breath awareness. I think you want to use breath as a life force more than anything else.
Correct.
That's right.
See, you cannot, um, you can say, diffuse stimulation with stimulation. I have a note on that also. I've done a lot of, you can say, in a review work, I would say. So I have a very, very scientific, backed by scientific facts, a 25 point list why you should not do exercises. Why? Because when you do an yoga asana, it is a stretch. A stretch is the core aspect plus awareness and breath alignment. While exercise is contraction.
Okay.
So that is the core difference. Where here lactic acid is generated, there lactic acid is diffused when you
Okay.
are stretching.
Okay.
There are tendon organs, the sensory or you can say receptors in the tendons are activated. Here the receptors in the muscles are activated in exercise. So
Okay.
that's why you are seeing so many people who are doing a lot of exercise, collapsing and dying and all that, because actually you are doing the same thing. You are not balancing it. You are like only one side of the passbook. You are just withdrawing, withdrawing, withdrawing. You are not depositing anything.
Recouping नहीं है.
एकदम नहीं, एकदम नहीं, एकदम नहीं. Exercise, gym is very dangerous, and mm, I'm telling you, like you have to uh, view soft stretching in the morning is is thousand times better than all this gym, Bali. I'm telling you. Anti-gravity, like again, when you are stretching yourself up, you are stretching the muscles which are the whole day they are balance, carrying your weight. Sideways, those trunk muscles are never used in the during the day. Twisting. So these are very simple things which you incorporate. So why I am calling it also like a 0 minute yoga, because I don't want that anybody like saying that I don't have time, because I say that you don't need to even give 1 minute of your take out any 1 minute from your routine.
Mm.
My total effort is that let it be a part of your routine.
Yes.
The key is, ma'am, that you don't do yoga, you be in yoga. Yoga is in a state, it is not an act. That's the basic difference. So once you are converting into an act, then there's no difference between a gym and this. Here it is like when you are eating, you can be in yoga. Any activity, while you are in any activity of yours, you can be yogamaya. You can be in yoga, and that helps.
Ah.
So it should be a part of any. We should not tell people to change their uh, routine. It should be just amalgamated with their routines so that they can actually do it every day and they can benefit from it.
Yes. I think that's very, very well said. To be in yoga, you don't have to do yoga. I think
Yes.
हमें योगा करना नहीं है, योगा में रहना है, योग में रहना है. Yes, okay. I think that's very very important. जब भी मैं आपसे बात करती हूँ मैं बहुत motivated हो जाती हूँ for breath awareness as well as for for being in yoga. I hope this time it stays with me and 42 days I will try so that
नहीं नहीं, वो करते कुछ नहीं, वो आप इधर से शुरू कीजिए. ऑल आर पैरेलल प्रोसेसिंग, देयर इज नो सीरियल प्रोसेसिंग इन योग, and each small effort helps so and contributes. Uh, but na hathat na balat, you have to be very very comfortable, like don't make it like make it an issue out of it. So just whatever happens, fine. That is because that is the ultimate yoga, being
uh,
joyous. Should not be miserable for you.
So, about you personally, what is one daily habit that you feel very happy about or you feel very satisfied about and which you have followed for many decades now?
Yeah. So see, for this I have been kicked out of my hostels and all. That is early rise. Medical college, hardly anybody wakes up early.
Okay.
So, and when I would be waking up, everybody will be going to sleep. So
So,
that's
early
very
rising has been with you consistently.
consistent. That has been with me from the beginning. And usually, just I come out in the fresh air. That is most very
And
important.
if you happen to have, let's say, sad mood or a bad day, what do you do to lift your spirits? Or you never have such day?
Ma'am, I'm telling you, see, uh, I was a person like any other person, any other medical college faculty or a corporate guy till 2010-11. And I used to have bouts of fever, 3, 4 days, 5 days, very high fever, very high. That time also, because I had these concepts of healing and all that, so I used to consider, okay, hardly taking any medicine. I have to just rest and water and very high fever. It would go. 4, 5, 4, 5. I think that was a way of like clearance. Now I realize what was happening. So once I started doing yoga in 2010, after that, not even half day I have been ill.
Okay.
Simple zero. That day and this day, not even a half day absence due to illness. Nothing till date. Later on, when I started and the physical aspect was working fine, when I in the 2018 I went for Sadhguru, certain additional things I learned, and after that, it's very clear. See, the point is that in the physical realm, you have to live like there is no like you may not be next moment. You should be that light and ready to go. Ma'am, yesterday 1 year junior to me, and the most you can say you can say diligently lifestyle follower and perfect health guy just died. Heart attack. My colleague. He operated, came out, and collapsed and died. So you have to be like I can go next moment, and spiritually you should know that you are not going anywhere. You are there forever. So this combination of in the physical world, there is nothing other than this moment. Past moment, when next moment, infinite variables are there. What is going to happen, nobody knows. So you should live moment to moment. And next moment, if I go, I go. Spiritually, I that's why I am now joined a course of Ayurveda through Sanskrit. 3 year course I have joined, master's course.
Okay. Okay.
So because all these learnings go from birth to birth.
Mm.
So if I am somebody learning Sanskrit at the age of 70, they should go for it. So you should that is one another way of getting engaged to learn something. Try to learn something at any age you can learn
Yes, that's good for
diligently.
cognitive health as well.
Very good, very good, very good. Small
Yes.
courses they should do teach and learn. Teach
Yes.
something and learn something.
Understand.
Fantastic combination.
Yes, वेरी नाइस। बहुत अच्छा लगा डॉक्टर विनॉय आपसे बात करके। इट्स ऑलवेज मोटिवेटिंग, ऑलवेज एनरिचिंग। और बहुत हम लोग आई थिंक हमारे लिए बहुत सारे टेक अवेज हैं। आई एम श्योर हमारे मेंबर्स के लिए भी बहुत सारे टेक अवेज हैं। थैंक यू सो मच फॉर शेयरिंग दिस योर विजडम विद अस। आपके इतने 40-50 साल का जो हमें एक निचोड़ मिल गया है 1 आवर के एपिसोड में, वी आर रियली ग्रेटफुल फॉर दैट। थैंक यू वेरी मच। And to our viewers, I would say thank you very much for watching this episode. And please do follow what Dr. Vinoy suggested, and keep watching our more episodes. Thank you very much.